Distinguished guests, ladies and gentlemen, good afternoon. First of all, allow me to express the apologies of the CS of Health, Honorable Senator Mutahi Kagwe, who until yesterday evening had planned to grace this occasion, but due to exigencies of work, had to attend to another important assignment in Nairobi. But Honorable CS is with you in spirit, and with that, he gave the mantle on to me to be able to stand in for him. I want to start, before I read the speech officially, by appreciating the board of Tenwek Hostel plus the trustees. When you were introducing the board members and the trustees, one thing struck my mind, and that is the skills mix that you have in the board. And I think as a government, you have important lessons to learn from this as we strive to restructure our organizations. I was very, very happy to learn that there's an HR specialist in the board. There's somebody who has a business background in the board. We have a legal mind in the board. So the entirety, in its entirety, the board has the full complexion of the necessary specialists to be able to come up with very good programs. No wonder we are launching such an important program in your hospital. It is basically because of the people who sit there, who can be able to canvass and think about the vision of where the hospital is going to be in the next tens of years or hundreds of years. And with the blessings of the Almighty God, this will come to fruition. As I stand here today, I'm fully cognizant of the state of cardiac health in our country, which continues to be a big challenge amongst the Kenyan people. Approximately out of the 35 million people who suffer from rheumatic heart disease, as Dr. Raz said, 150,000 of those are Kenyans. And without heart surgery, without you physically and spiritually touching their hearts, unfortunately, we are going to lose them at the prime of their age. I remember I talked of 26 years at most without any intervention. That is the prime of anybody's life. I believe some of the residents who are pursuing this could be in that age group or slightly older. So you can imagine if we are going to lose all these people, and it is very, very saddening to learn that we have 650 people on the waiting list, and every week we lose one or two. We cannot allow that situation to continue. It is estimated that 4,000 Kenyan children are born with congenital heart disease annually. But how many of these are able to access the interventions necessary to ensure that they live a productive life? Ladies and gentlemen, the Cape Town Declaration on Heart Surgery Capacity estimates that Africa has only one specialized cardiac center for every 33 million people, and recommends that a nucleus of specialty training and referral centers be constructed. So we can say for a population of 50 million Kenyans, we are soon going to have our first cardiothoracic center, courtesy of Tenwek Hospital. And this means that ideally Kenya should be performing 15,600 heart surgeries annually. Unfortunately, this number is below 1,000 due to lack of capacity, and the situation in surrounding countries is far worse. But it's glad to note that in this arena, Tenwek again is the leader in terms of performance of open heart surgeries, which stand at more than 2,000. The Ministry of Health would like to commend Tenwek Hospital for the huge leaps it has made in terms of transforming health care services in the South Rift and the Western Kenyan belt at large. and specifically in the area of making cardiac health services accessible and affordable to people, especially of low or with low financial resources. I'm pleased to know that New York Hospital was the first rural hospital to perform open heart surgery out of Nairobi in 2008, and you have performed more than 2,000 minor and major heart surgeries, and you are the #1 facility in this area in the Republic. I'm also glad to note that you don't only physically mend the hearts, but you do it also in a spiritual way, in a total holistic way that changes the lives of the people you interact with entirely. And that the prayer is the bedrock of your service provision, and this is key. Clinicians normally look at patients as cases, and we basically look at patient as a case, and this is a case of severe malaria, with not looking at the entire spectrum of where does this patient come from, what is the social background of this patient, who are the relatives, who is the father, who is the spouse, which is very critical in the healing process. I urge you to continue in that spirit. And Chair Bishop, I agree with you entirely. Each institution must have its own way of doing things. And if the Christian mission is the bedrock of the Nuert's delivery of healthcare system, so be it, and we'll support it fully. My bishop want to assure you that the tax exemption will be processed. Just send us a letter to the PS. We will be able to liaise with the National Treasury, and because this is key to us as a government. You are coming to plug in and fill a gap that we as a government have not been able to fill. How best can we then support you if we don't grant you this tax exemption? I want again to appreciate the leadership of Your Excellency Dr. Bachok and your team, your CEC of Health, my colleague Dr. Sitoni, and I appreciate the collaboration between your county government under your leadership and the faith-based and private health facilities, especially in the supply of oxygen, a very critical, essential element. For a long time before COVID came, even very many senior doctors did not know that oxygen is listed as an essential medicine by the World Health Organization, because we took it for granted. And I want to thank you again for the good work that you have done. I know Bomet is with the 13 counties of the Lake Region Economic Bloc, in which we have put some interventions to be able to stem or break the chain of transmission of COVID-19. And we're already seeing good results. The attack rates are coming down. The number of people admitted in hospitals is also coming down. Your Excellency, you have just told us you have 9 patients only, again, a sign of good progress. But that is not to mean that we lower our guard. The virus is still in our midst, and we need to continue to adhere to the simple measures that we continue to announce to you. The Ministry of Health will continue to support county governments and the faith-based institutions in delivery of healthcare services. And your plea for health workforce, especially in critical care, pathology, endoscopy. We are glad that we have also expanded the scope of training of our health workforce. And as we churn out more people, including through the program that we are going to launch today, we'll be able to have additional capacity that we can be able to deploy to the respective counties. I've been personally to the Koiwa Isolation Center with my boss, Dr. Rashid, sometime last year, and we really appreciated the good work there. And we'll be able to support you in your endeavor to be able to upgrade Koiwa and Kakoros to level 4 facilities. Anything that is within our scope, you can count on our support to be able to help you to achieve your intended goals. On the vaccination for COVID-19, you know, as a country we are on course. The main challenge that we have had is basically availability of vaccines. And it is because of our successful program that many of the developed nations have been willing to donate additional vaccines to us because they know we have capacity to deploy. Remember, most of the vaccines have a very short expiry period, but the one we got from France last week, I think, expires around August. So you can't just send them anywhere if you know they don't have capacity to be able to utilize them. I'm sure out of the 182,000 or so, Bomet will be able to receive its rightful share. And my appeal to Kenyans is that when your time comes and when the vaccines become available, please avail yourself and get vaccinated, because this disease is going to be with us for a long time to come. And the only way to ensure that you're not admitted or you don't suffer serious COVID disease that could lead to a mortality is through vaccination. And we require to vaccinate a significant proportion of our population before we can be able to lift these containment measures we have put in place. We need to start getting back to normal as soon as the vaccines become available. Between now and December 31st, we hope to vaccinate around 13 to 14 million Kenyans. We have placed an order for Johnson & Johnson vaccine. Initially, we placed an order for 10 million at about 3.5 billion shillings. But we negotiated very strongly, and out of that, we are now going to get 13 million doses. The beauty of that vaccine is that it's a single shot, and we believe our program of immunization can be able to quickly deliver it, these 13 million or so people, in a very short period of time. We have just conducted a polio campaign and a measles rubella campaign, and targeting about 3.5 million children, and we do that in about 5 to 10 days. So doing 10 to 13 million in 4 or 5 months is no big deal. I'm sure we are up to the task. And Your Excellency and Waziri, Dr. Sitonik, when that time comes, we need to mobilize our people and ensure that this critical and scarce resource is put into proper use and everybody then can be able to access. On 200-bed mother and child hospital a while back, and the beauty of presidential directives is that it's usually somebody who is tasked to be able to capture it. There's a letter in our office signed by the head of public service regarding this, and we are working with the National Treasury to start allocating us finances so that this dream becomes a reality. Regarding cancer, there is an ongoing miscellaneous amendment bill before Parliament, and one of the proposals we have made is to ensure that we have a comprehensive cancer center in all the 47 counties, which with an emphasis of cancer prevention through health promotion and early screening. And once this bill becomes law, then the National Treasury will be required to avail the resources for construction of the cancer centers in all 47 counties. As I conclude, ladies and gentlemen, let me once again commend the good work the management of Tenerife Hospital is doing and urge you to align to the universal health coverage. And I'm glad when we met at the boardroom, despite you doing this super specialized service, you have not forgotten the basics of medicine, which is health promotion and health prevention. And I'm glad that you have a fully functional and robust community primary healthcare approach to community engagement. You go out to the community, do the screening, deworm children, immunize them, check pregnant mothers. That is our vision of how we are going to achieve UHC, as clearly articulated by Hazel, who was the former CEC of Health in Mombasa. And we want to partner with you in this journey towards UHC again, because I told you we only deliver 50% of healthcare. So you play a critical role in filling that gap of the remaining 50% together with the private sector. And it is only through joint collaboration and continuous dialogue that you can be able to make this journey a dream, this dream become a reality. I also appreciate the fact that the charges that you levy on the services that you provide are minimal. And I'm really happy to note, Your Excellency, that more than 70% of the clients who come to seek services here are actually members of NHIF. And that is the way to go. If you can be able to afford, before the government reaches out to the indigents, please commit to pay that 500 shillings every month so that when tragedy strikes, then you are prepared. It is like in the Bible, the man who built his house on a solid rock foundation, and when the floods came, he was able to withstand. By you paying for NHIF, you are building your house on a solid foundation. With those many remarks, ladies and gentlemen, I now want to officially declare the commencement of the construction of the Tenere Coastal Cardiothoracic Center officially launched, and wish you well as you begin the construction process. Thank you. God bless you.